Welcome back, dear viewers, and our first guest of the evening is Dr. Ahmad Akroof, consultant in periodontics and implants dentistry and the head of periodontal unit and Al-Adan Hospital. Dr. Ahmed, good evening and welcome to Hala, Kuwait. It's really a pleasure to have you tonight with us.
Thank you very much for having me. Thank you for the viewers. I wish we give, inshallah, important points tonight, inshallah.
Definitely. And tell us first, doctor, about the dental implant.
Yes.
Tell us more about it. We're really curious to know more.
Well, dental implant, just to give it as a definition, it's a metal post that is inserted in the jaw to replace actually the root. Sometimes they get confused that it's going to replace the whole thing. It's not, because the implant or the metal post, as it sounds, it's actually we're replacing the root that was lost, because the implant itself, it's composed of two parts. The part number one that is going to be inserted in the jaw, and then comes the second part, which is the prosthetics or the crown as we call it, and then we put it on the top of that implant. Now, why implants in particular? Because now nowadays we have aging population. There are problems with the fixed prosthodontics over a long period of time. There is sometimes the removable prostheses, people don't like it. People now also want a long-standing fixed prostheses, and also the public awareness. This is something that we are facing now, and it's coming. People know communication revolution. People know much about the dental implants.
Definitely.
Yes.
Let's talk about the people and the experts, about the people who are lobbying for the conventional bridges versus the dental implants. What do you think about it, doctor?
This is a beautiful question, actually, but I will tell you this. We face this every single day of my clinic. So, doctor, shall I do an implant or shall I do a bridge? You know, to give you the right away answer, I would say yes, it's the implant is the best option that we can do. And the reason for this answer is because doing a dental implant, you're going to replace only the missing tooth. Now, if you compare this one to a conventional bridge, you are going to prep the adjacent teeth from the lost area. So in that regard, you are damaging two natural teeth to place a bridge. In comparison with the implant, you are only restoring the area that you are going to deal with. So the answer is dental implant should be the top of the list and should be number one. Now, is it always like this? And the answer is no, because there are certain times that dental implant will be a contraindicated, as we will discuss through the interview.
Exactly.
But in majority and most of the time, we say dental implants is actually the right treatment of choice and should be number one treatment of choice.
How about, doctor, we go deep into the details with our and share it with our dear viewers. And we're wondering also about the materials and dental implants that's used in dental implants. Tell us about specifically about the materials and why we use the specific materials you're going to mention.
This is a great question. In short, I would tell you that the material of choice that we have today is the titanium. Now, I will give you some historical aspect for titanium, because this is very important to know that where we have reached this level, and this is not just a new technology that we have developed just right now, but it's actually it's a big thought through civilization. Now, the humankind thought about dental implants thousands of years. Now, the Chinese, 5,000 years, they thought about it. They made out of bamboo. They tried to mimic the dental implants. So this is part. So we have to know that civilization and all over, we are helping each other over time.
That's right.
So the Egyptians also, they did the same thing. But the main thing that happened, and they discovered, actually archaeologists, a skull for a lady in the 30s in France, which belongs to 2,000 years ago. And what was amazing about that discovery, when they found it, they found actually a metal that looks like an implant. That was shaped, it was shaped like a tooth, natural tooth, but it was made out of metal. So the scientists, it made them amazed. Now, at that time, 2,000 years ago, there is no anesthesia, so there is no sedation. So how did she tolerate all this pain? That was question number one. Question number two, placing a metal, a first metal, in the patient, definitely it will induce an allergic reaction, and if she doesn't die from pain, she would die maybe from allergic reactions. So they wanted to know the answer, and the answer was very interesting also, because at that area, people, and maybe those customs are also still today, people when they die, they want to present them in their best way. So they discovered that the religious customs in that area, yeah, so to give the person the final look from his friends and family, they would like to present him in his best way. So that metal was carved after her death. So they found this answer, but to make it short also, humankind, human civilization thought about dental implants. Now, maybe the revolution, the big revolution that happened actually for dental implants, let's say in the 50s, Dr. Brennemark, 50s, 60s, he was actually not a dentist, by the way, he was an orthopedic, and he discovered, and he wanted to help his patients, because his patients were older patients, and when you get older, sometimes, especially at that time in the 60s, you will lose many teeth. This is in the 60s, we cannot compare it as today, of course. There's a big difference. But anyways, he wanted to help his patients by discovering something new. And he wanted to develop, dental implant for patients, because he was an orthopedic. So he tried to mix those parts, the medical part with the dental part. And we reached from those studies, those were very extended studies. By the way, they came from Sweden. And it was more than 10 years studies. It was done on animals first, and then it was transferred to human studies. And he used the titanium. Titanium is a very beautiful metal, and the reason for it, and because that was part of the question, is why we use titanium. Titanium is a self-healing metal, which means if we compare it to other metals, the only problem that we have with metals is they corrode. Now, with titanium, titanium does not corrode. And the reason for that, because there is an oxygen layer around that metal. The moment this metal is scratched or anything happens to the titanium, it will cover itself in milliseconds just to cover itself from the corroding factors. So that's why titanium has been used since the 60s, and we still use it until today with a great success. And implant density today, we have reached actually more than 97–98% of success.
That's great. Let's mention, doctor, let's stay in the present days. Like when we mention the recent knowledge of people and the awareness of people, and what comes to the oral health awareness, yes, and the recent technology in different clinics, and many clinics, mashallah, yes, everywhere, yeah, and high awareness and high care of the oral health from absolutely the doctors and the people who are having sure any issues. Do we still see people who can lose all their teeth or all their tooth because of something that might damage them? And do we have to replace every lost tooth with a dental implant?
Yeah, this is an interesting question actually, and we can see this. Now there are different factors for something like this. Sometimes we have neglection for some people. They did not follow up with their dentist. They didn't follow up the problems that they have. And now we don't see it as much as we have seen it in the past, but it's still there. There are different factors actually. There might be some oral disease that's related to this loss, or sometimes some medical conditions. But overall, we don't see it as much. There is percentage of people that we see them, they are losing their old teeth, and we need to restore them, especially with the older population. Now, as you mentioned regarding those people, sometimes people will come and they say in the clinic, okay, I am coming here today, I don't have those teeth, I want you to replace every single tooth. This doesn't work. It's not like this.
They want the shortcut.
It's not like shortcut. It's like they think, and this is the reason that we do those interviews, is just to give awareness to the public, to the people. Dental implants are not exactly as the tooth. There are different parts of biological differences between them. Now, the natural tooth is it's a natural. There are ligaments in those teeth that are not present with this metal that we are using, which is titanium, or the dental implant. So there are definitely differences. Now, why don't we use every or implant for every single tooth, because for blood supply. Now for teeth, they might be close to each other. That's fine. Natural teeth are fine because of the ligaments. But if you put a metal, you cannot do this. You want to separate them apart. There are certain mathematical formula we have to follow to put those implants. But we have to, and the reason is because we need to increase the blood supply to the areas. So the answer is big no. Actually, we don't replace implant for every single tooth a person lose or lost. And this is very important because I face this sometimes. People come, you know, doctor, please replace every single implant I lost. It doesn't work this way. So you will ask me maybe what is the solution? There are, of course, the solutions, because sometimes what we do, we might use, let's say we lost three teeth, for an example. We would put, for example, 2 implants, and then we put a bridge on top of them. And that would be the solution. And we have many options to do, but in generally speaking, no way. It cannot be done. Not an implant for every single tooth.
Well, we're really thankful to you, Doctor, for the valuable information you're sharing with us in this inspiring interview. We'd like to have a last word and recommendation from your behalf, Doctor, please.
My last word, please go and see your dentist, make a follow-up. This is very important, because usually when you catch the problem as early as possible, the solutions are very simple. Things get complicated when you delay your treatment or checkups. So this is really my main advice to everybody, and thank you very much for having me in this show.
It's a real pleasure, Doctor, and thank you so much, and we wish you a lovely night and enjoy your week also. Thank you so much. Best of luck.
Thank you.
The viewers, we just had with us Dr. Ahmad Akroof, consultant in periodontics and implant dentistry and the head of the periodontal unit in Al Adan Hospital. We'll take a break and we'll be right back. Stay tuned.